These little plastic tubes are inserted into the necks of around 20,000 patients in the United Kingdom per year. The problem with being dependent on this little plastic tube to keep your airway open and to keep breathing and to stay alive is that they require competent, knowledgeable and confident staff to look after them to keep patients safe. We've been aware for many years about the problems in not keeping patients safe with these little tracheostomy tubes. Typically they can get blocked or they can fall out if you don't look after them properly. In around a third of hospital admissions, some measurable harm occurred to patients. And if some harm occurred, because of the nature of the problem with your airway and your breathing, the harm was often significant. This led us to devise the first safety and quality improvement programme in tracheostomy care, which was delivered in a pilot setting. Key interventions included setting up institution-wide multidisciplinary tracheostomy teams to make sure that patients were safe. We tried to standardise care wherever possible by developing checklists and flowcharts to keep care safe and simple. We made sure that staff were well educated by developing protocols and educational packages that were available and taken up by over 4,000 staff over the course of the programme. We also had very simple aide-memoirs such as bedhead signs that told staff at the bedside exactly what was wrong with the patient, and on the back of these was what to do in an emergency. We then guided sites through a guided quality improvement programme to make sure we helped them make these changes, learning from each other and looking externally for QI expertise when necessary. This made sure that we made changes happen in the sites. We also involved patients in each of these meetings to make sure that we focused on the things that patients told us were important to do. The headline results were that we achieved safer care. There was a 55% reduction in the severity of incidents that occurred. We also delivered higher quality care, with a nearly 50% reduction in anxiety and depression measured amongst our patients. Tracheostomies were removed sooner, and patients got talking, eating and drinking faster. And in some sites, the return to talking was often a week earlier than it would have been prior to this programme. This led to a 20% reduction in the intensive care unit length of stay, with significant cost savings, and it also led to an overall about 20% reduction in the hospital length of stay. We also embarked on innovative education programmes, and we used social media to take new videos that were developed with the Health Foundation and send them out to staff via their smartphones, reaching over 1.1 million users around the world during the course of this project. We've listened to what patients have told us are the problems with care, and we've used that to support the data that we understood ourselves. We've taken best ideas from around the world and we've implemented them into the core of services in the NHS, led by patients. We've measured patient-level data and showed a significant impact on the quality and the safety of care that we deliver. This has also demonstrated significant economic benefit. This has been recognised by rolling this programme out throughout the NHS, and other sites and systems around the world are looking at what we're doing.
Although we say the words like teamwork and patient engagement, that's something that they really took hugely seriously. Our screen was filled with allied health professionals, doctors, physiotherapists, speech language therapists, nursing staff, and most importantly, there was a patient representative actually there on the Q&A session with us, which was fantastic to see. A huge congratulations to that team, richly deserved, and it's amazing that this project has already impacted the lives of so many patients with tracheostomies throughout the UK and hopefully beyond.
This quality improvement project was a fantastic example of collaborative, multidisciplinary working with patient safety placed right at the very heart of their work. The Royal College of Anaesthetists sponsors the Anaesthesia and Perioperative Medicine Team of the Year Award because we are determined to champion the very best perioperative care delivered by clinicians and healthcare professionals from all disciplines. And we are very much looking forward to see you again in 2021.